Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun. Hey guys, do I have the show for you today? You know, y'all are my girls, and I enjoy and love sharing my journey with you. So now on this next part of my journey, I know I had told you guys I'm not going to get a facelift till I'm 50, but I'm looking at my face and I'm starting to see that it doesn't look how I remember it looking. So there's also been a lot of talk online recently about something called baby facelifts. So today I have Dr. Jeff Lisiecki out of New York, and he is going to be our expert on the baby facelift, or here we go. What should I do as a woman, a 34-year-old woman who's starting to notice changes on my face that I'm thinking, that age train is running right at me. So Dr. Lisiecki, I'm so happy to have you on the show, and I can't wait for my audience to get to hear all of the options that they have and just share with us your knowledge.
Yeah, thank you so much for having me. Love this conversation, and I'm very happy to be on here with you. So thank you.
Awesome. So Dr. Lisiecki, like I was telling you off air, I'm starting to notice things on my face, like my jowls that are really starting to bother me. I've always had large cheeks and I've always had a large smile. So my smile, and I know from being in the consultation rooms, big smile lines are something a little bit tough to take care of. So I'm really interested in hearing from you. What are the options for women in my age group who are starting to notice these facial aging signs? Give me a glimpse into an in-office consultation.
Absolutely. And this is the consultation I have all the time. I have this conversation with women from their early 30s all the way into their mid 40s who are really, they're starting to notice the deeper smile lines, a little bit of jowls, a little bit of loose skin under the chin. And, maybe they've done Botox for a while, they've done a little bit of filler, but they're kind of unsure which direction to head into. And they want to do something to address what's bugging them, but also stay looking natural and very much stay looking like themselves, or themselves version that they liked from their late 20s. And so yeah, in this age bracket, there's a whole spectrum of options. This is not, 70-year-olds who the only reasonable option is a facelift and neck lift. People who are in their 30s, early 40s even. There are a lot of things we can do, and it really depends on what you're presenting with, what your anatomy is doing, and what sort of procedure you're ready for personally. So, with deep smile lines, the big thing we think about is volume loss. People lose volume in this area next to their nose we call the piriform region. And restoring volume there is huge. So either with fillers or fat grafting. We also, this is the point in aging where we start to lose some cheek volume also. So we think about adding volume back to that area, again, fillers or fat grafting. But then the real question area becomes the lower face. And everything from kind of the corners of the mouth down, where we're noticing some sagging starts to happen, a little bit of jowls, some volume loss, and really talking about getting the lower face nice and tight, the jawline nice and smooth and well contoured. And this is where we start to have the conversation about, are we talking about a skin tightening type procedure, or are we talking about doing a facelift? You're kind of, if you don't mind me using you as an example,
Please do.
Because we're talking about you, and actually, we haven't talked about what you've actually done to, on your face.
I don't have anything in my face other than lip filler and Botox.
Okay, no surgery on your face or anything.
I had neck lipo. I had neck lipo in 2019.
Okay, great. So yeah, there are a bunch of things we can do for tightening the lower face and really contouring the jawline and keeping you looking like yourself. The first thing that I look at is, do we have too much fullness in certain areas? That would be the submental area where we can do some submental liposuction. If you have a little bit of fullness from in the anterior buccal area, sometimes a buccal fat pad reduction comes into play. If you have fullness in the posterior buccal area, sometimes masseter Botox comes into play. But really the challenging thing is looseness in the skin, or not the challenging thing, the thing that we need to start to contend with in our, 30s and certainly into the 40s. And this is where, we're discussing, are we going to try to do some sort of skin tightening procedure, like a face tight underneath the chin, a bunch of rounds of Morpheus to the lower face? It can work very nicely. Those things can be very, very powerful in the right person. They don't replace a facelift, though. So if we're talking about baby facelifts today, the thing with all of those skin tightening procedures, they're nice, they work, they help tighten your jawline. A lot of people are really happy with them. But I think I always view them in the context of we're delaying a facelift, or we're kind of, I don't want to say putting off the inevitable, but we're addressing your concerns. We're addressing what's bugging you right now. But down the road, we're probably not really avoiding a facelift. Maybe we're just putting it off by a little, by some time. So to me, the big difference in, are we going to try to do one of these skin tightening procedures to make your jawline sharper, or is it time to pull the trigger on the facelift, is really in the jowls and the lower face. If you're starting to get, some significant jowling heaviness in the lower face, and especially if you're missing fullness in mid-face, that's what a facelift does. A facelift, sure, it removes skin and you can remove fat and you can reduce big glands if you have them and all that kind of stuff. But really the power of a facelift is in manipulating the SMAS and in transferring, volume and redistributing soft tissue and tightening up the ligaments of the face to get rid of fullness and heaviness in the lower part of the face and move it back up higher on the cheeks where we want it, where we want that nice fullness, that light reflex that looks really nice. And so in people in their 30s and 40s, it's not really like a facelift in a 7-year-old where you're obviously going to do everything, but we want to take off, a lot of skin in most cases. The baby facelift, the facelift in the late 30s, early mid 40s patient is really about restoring volume with fat grafting and then redistributing volume by, doing whatever your preferred technique is for managing the SMAS, but tightening up those ligaments, the deeper structures of the face, and in giving you a nice sculpted lower face where you don't have hanging saggy jowls, and in restoring fullness and really good shape to the cheeks. So you get that nice light reflex. It looks like you're contouring, but you're not contouring.
I love that. I love that. So for our girls who are looking in the mirror right now, or maybe they're listening to this podcast episode and they're looking in the mirror, maybe they're in the car and they're going to be looking in the visor. So you're saying in your practice, when you're looking at a patient, the main deciding factor which way to go, whether with skin tightening treatments or talking more about a baby facelift or a facelift, is the jowls. So tell our girls, since a lot of them don't know, what are the jowls? Explain to us where they are and why they form a little bit more.
Yeah, definitely. And if you're starting to get them, you definitely know where the jowls are. But jowls, it's a skin excess and it's a little fat pocket. So there's a little superficial fat pocket that sort of goes just out from the corner of your mouth and down along your jawline. Sometimes it even hangs below your jawline a little bit. And it's a fat compartment in our face where it grows with age and it sags a little bit with age. So it gets larger and it droops sometimes below the level of your jawline. And then you get some skin looseness in that area as well. So, we're not talking about young patients who have, anterior buccal fullness who need a buccal fat pad reduction. We're talking about people where there's loose skin, heaviness in the lower face, and, fullness, extra fat in that area, sort of just to the side of the corner of your mouth, down, just to the side from the marionette lines. If you notice, marionette lines and you've got filler in that area, or some people call it the prejowl sulcus, that area you fill in to make the jowl look less apparent. The jowl happens because there are ligaments in that area that stop the skin from sagging medial to that line towards the center of your face, but off to the side of that hollow that we often want to fill in, the skin isn't as supported and it has the ability to sag. It's that little extra bit of fat and skin that you just want to grab and cut off.
Yeah. So with that, if you're listening at home, if you went somewhere and you see excess skin, you see this fold or this jowl, and the recommendation is not a facelift procedure or something more permanent, you might not be getting the most bang for your buck for your treatment. I always like to talk to my girls about how they're going to be spending their money through these procedures so that they can make sure that they don't spend money on procedures that are not going to give them the result that they're looking for. So I hate hearing of girls who I talk to that are like, I went to this spa and I had 12 syringes of filler put into my face. And it just makes me so mad because I'm like, you could have put that as a down payment on a facelift, which is probably what you needed, or something more permanent. So these are those types of conversations that I like to have with my girls so they know and they don't go somewhere and have 12 syringes of filler put in their face.
Yeah, definitely. That's a story I hear a lot also. And it's not that there is no option if you don't want a facelift, if you're not ready for a facelift, if you can't afford a facelift at the moment. It's not like there's nothing else to do with a jowl than a facelift. But exactly as you said, it's about the permanence and it's about the most natural balanced treatment that will keep you looking like yourself. Because the other problem we run into with 12 syringes of filler to fill in pre-jowls and jawline and cheekbones and, make that jowl look less obvious, aside from spending money on 12 syringes of fillers, is also then you have 12 syringes of filler in your face.
Exactly.
A lot of people who come in and they don't look like themselves anymore. They say, I don't know what happened. I was going to my injector every 6 months, getting a syringe of filler here, syringe of filler there. And I say, show me a picture of yourself from, 3, 4, 5 years ago before you started doing this. And it looks like a different person. And it's really challenging because it's really easy to fall into that trap, especially in this age range that we're talking about, this age range that we're in of being in our, mid to late 30s, early 40s, where, you want to kind of feel your way out of the problem. And when you were, in your 20s and everything was a little bit tighter, you could put in a syringe of filler and bam, your cheekbones pop and it looks amazing and, all that great stuff. But sometimes when things start to get a little more loose, you can't just fill and fill and fill more and expect your face to look the same way, to be the same shape, because it's just not going to be. And so I see a lot of people who did that are annoyed because they spent all this money on filler and are more annoyed because they don't look like themselves. They don't look the way that they want to. And then we get into, an even more challenging situation because, instead of starting from a blank canvas where, I can, restore the shape of your face back to what it was 5, 10, however many years ago, we need to do corrective work. So, I've had a good number of patients where, they have this overfilled, loss of natural shape, loss of natural contours, and I need to dissolve a bunch of filler. Coming back, we're putting in, multiple vials of Hylenex, which is the dissolver for filler for those who aren't familiar. We're doing that every 2 weeks, dissolving, just to get you down to the point of, being able to actually do something about it. It's really tough. And people don't particularly like that process either because they're watching that aging happen pretty quickly.
Time.
Yeah, exactly. Because all that filler is getting dissolved and they're realizing, that the problem wasn't that they needed more fill. The problem is that their skin is loose. Their, ligaments of their face are loose. Everything needs to happen in balance. Doing things out of balance is the problem. So if I just do a facelift and I pull on your cheeks as hard as humanly possible, your mouth gets really wide, your cheeks look really gaunt. It doesn't look good. That was facelifts in, the olden days where people's mouths got really wide. And that's not good either. But it's also not good when you have a little loose skin to just fill it up like a balloon and, think that you're just going to fill your way out of the problem. It's going to change shape. It's not going to look like you. You're not going to be happy with it. So good facial rejuvenation is addressing things in a proportionate, even way everywhere. So, tightening skin, repositioning tissues, and adding volume in the right places. And that's really
the trick. That's really the trick. That's the secret sauce, you guys. He's giving y'all the secret sauce.
Very much so.
So tell us, what are your favorite skin tightening procedures for face and neck?
Yeah. So that's an easy one, because there's one that I really like, for face and neck, for patients who aren't ready for a facelift or just don't need it yet. I really love the InMode devices for skin tightening. So I use FaceTight a lot. I use it especially in the submental area underneath the chin, that, double chin area. So instead of just doing chin liposuction, which is great for younger women where your skin is really nice and tight and it's going to snap back into place, the FaceTight really lets me do tightening and fat reduction in that area in people who do have a little bit of loose skin, people in the, 30s and sometimes 40s, and get fat out, but also tighten the skin a little bit. So we're not just creating, a skinnier turkey neck. And then along with that, also, I really love the Morpheus, which is the radiofrequency microneedling machine. I do that with FaceTight a lot. It's just kind of the icing on the cake. It improves skin texture. It thickens skin a little bit. And it just kind of helps contour and, shrink wrap the lower face a little bit when I'm doing a FaceTight procedure.
I love that. We haven't talked about Morpheus much on the show, so I'd love for you to educate our listeners on the Morpheus treatment.
Yeah, definitely. So Morpheus is a radiofrequency microneedling treatment. It's a microneedling device, so it pokes a bunch of needles into your skin, usually 24 needles on the normal Morpheus tip. And then it uses radiofrequency energy to heat those needles, heat up the tissue that it's stuck into, which, if it's in your skin, heats up the skin, signals to your body, we need to grow more collagen, tightens the skin. So it smooths out skin texture, it can shrink pores, and then provides a pretty good degree of tightening for a non-invasive or minimally invasive treatment. And it's just kind of the icing on the cake. When I'm doing one of these procedures, these skin tightening procedures, sometimes people have those tech neck or necklace lines, the wrinkles across their neck that everyone hates. Sometimes people have a little bit of looseness in the lower face area, a little bit of very early jowls, but they're not ready for the facelift, the FaceTight, but then also the Morpheus on top of that is really nice for kind of shrink wrapping that area and just tightens and smooths the skin pretty well. I will say Morpheus is usually not a one and done. So a lot of people are really happy after just one treatment with submental liposuction FaceTight Morpheus. But sometimes we go back and I'll do the Morpheus again, up to 3-4 times. And then sometimes for people who just don't want surgery, they don't want even submental liposuction or FaceTight, and we're just doing Morpheus, I tell people to anticipate, 3 or 4 treatments to really improve skin texture, tone, tighten up the face with just Morpheus. Most of those patients are younger patients, people in their 20s who are really starting to look at kind of prejuvenating and doing really good preventative measures to smooth out their skin. They're noticing some lines starting to show up. They're noticing that just Botox alone isn't keeping those lines at bay as much as they want. That's when I go and we plan a series of Morpheus, do 3 or 4 treatments spaced out by about 6 weeks apiece. And it's a really great tool.
I love it. I've always been a huge fan of microneedling since it came out. Just microneedling, I saw such huge changes in people's skin, on scars, on acne scarring, on all types of texture issues. Microneedling by itself is amazing. So then adding that radio frequency, I know, has just taken it to the next level. One concern I have heard a lot, though, and I'd really love to hear your take on it, is people who did Morpheus on their face and then lost some fat.
Yes. So yes, Morpheus can make fat go away. It works through heat. It heats up tissues enough to make some fat dissolve. So it's really important for the person doing it to be mindful of their settings. So, I generally don't advise that people just go to, wherever they got a Groupon for Morpheus.
Exactly.
Because, it's not a completely, even though it's a really safe treatment, it's a very, it's a good treatment. It can be done inappropriately. It can be done, too
there
deep.
There can be user error.
there can be user error and you can get fat to go away. And I know this very well because I actually use Morpheus sometimes to melt fat graft. So, I've had a few patients who have had too much fat grafting. They didn't need fat transfer to their cheeks in the first place, and someone went and put a bunch of fat grafting into their cheeks and they hate it. They don't look like themselves anymore. In that instance, I use Morpheus and I intentionally turn up the energy, turn up the depth, use it in a way that I wouldn't use it normally. And,
to get that result.
That to melt the fat graft intentionally. And it works really well for that. But,
wow.
It's if you're using those settings on a normal area that doesn't have too much fat grafting, you could inadvertently melt some fat and give someone hollow, sunken cheeks, which is not something that that we're going for.
Definitely. So you brought up such a good point of this is the reason why you can't just get a Groupon and go have it with the Groupon, because you guys, with anything that you're doing cosmetically, if I were you, I would not have treatments or procedures done in places that are not directly attached to a plastic surgery or a dermatologist office. I would not be getting Botox at the hair salon or filler at the hair salon or any of that stuff, because there are risks with all of these things. There's risks. And just because you do it over there, it doesn't mean the risk is less. The risk is still there. So you brought up a really good point with that. And I really want to enforce that rule. Let's make the rule. We're not going to go with providers for these treatments who aren't qualified. So give us an example of what a qualified provider would look like.
Mm-hmm. Yeah, absolutely. And it depends on the treatment and the complexity of the treatment. Obviously, for a facelift, a qualified provider is a plastic surgeon, board certified or board eligible plastic surgeon, particularly someone with fellowship training in aesthetic surgery. So there are these great aesthetic surgery fellowships. I did one of them where you can get real, very, very in-depth advanced training in these procedures. For something like Botox, fillers, Morpheus, that obviously is a much bigger umbrella of people who are qualified to do those procedures. That would be someone, depending on your state, depending on the state laws. Obviously, all states are a little bit different about who's allowed to perform treatments like that. But certainly find someone who has professional certifications, an MD, particularly plastic surgeon, dermatologist, ENT, or someone like a nurse practitioner or PA who's attached to a plastic surgeon or has done extensive training in plastic surgery, either through work experience or through other professional certifications. And then depending on where you're at, people like nurses who have adequate, appropriate training, who have background in all of this stuff. With anyone with any degree, with any professional certification, it's not a guarantee that they, know what they're doing, but it's certainly helpful. And then on top of that, you want to look at their results, ask for before and after photos, talk to them, make sure you feel comfortable with their plan, how they explain things to you, their level of expertise as you talk to them. Someone who's hemming and hawing and doesn't know an appropriate plan, or someone who hasn't done this procedure in someone of your skin type or someone with your particular problem. Just be careful.
Be a smart consumer.
Be a smart consumer. Yes, definitely. It's not about how many Instagram followers you have. It's not about
how cheap you can get it.
How cheap you can get it, how fancy their office looks. There are a lot of things that are distractors out there. And the real things to look at are training, professional qualifications, reviews from other patients, before and after photos, testimonials from other patients who got what you got, or got what you're interested in. Yeah, real concrete, tangible things that tell you this is a quality provider.
Exactly. Because you guys, there's guys on Instagram, there's doctors on Instagram with millions of followers who I get phone calls from their patients all the time that have had terrible experiences, terrible results. The surgery is super expensive. It wasn't even what they thought. And I'm like, how did you pay $75,000 for a tummy tuck? How did that happen? Where did you go? And they're getting tricked to go to these places that aren't really They're just Instagram famous. I hate to tell you guys, there's a lot of them that they're just Instagram famous because other doctors don't even talk to them.
It's so true. There are, and they're everywhere. They're in every big city and every marketplace. There are certainly some here in New York. And I've seen a lot of patients who have gone to, someone with a really fancy office or a quote unquote, famous name, who have spent tons of money on a thread lift that broke after a couple of weeks. People who had some really aggressive procedures where even a static before and after picture might look okay, but then you see them in person and, it doesn't look good or doesn't look nearly as good as, even the before and after photo. Yeah, it can be really, really, really challenging to find people who do good work, which is also where someone like you, someone in your position can come in and help be a little bit of a filter, be a little bit of an aggregator for reviews and patient experiences you're familiar with and all that kind of stuff, because it's very hard for people to navigate this.
Exactly. Thank you. I do it with a lot of love for my girls because I just want them to be safe, have the best surgery, and be happy with their results, not fall into body dysmorphia, and just go into living their best lives. That's 100%. My goal.
100%. Absolutely.
So I think we touched on some really great things today. The last thing that we have not talked about on this show that I know I've gotten a lot of inquiries about is lip lifts.
Yes.
Talk to us about lip lifts and who's the right candidate for a lip lift? When is it time? Or just give us the tea.
Mm-hmm. Yeah, definitely. So lip lifts are awesome. I love doing lip lifts. I do a lot of them. To me, I kind of put people who are looking for a lip lift into two different categories. There are younger patients who just aren't happy with the shape of their upper lip. They feel like it's too flat. It rolls in too much. It disappears when they smile. They want a more full, more colored lip show, more outturned upper lip. And then there are older patients who I'm doing a lip lift along with a facelift, where they've just, they've lost volume, that skin is stretched out, they just have a long flat wall between their nose and their upper lip, and we need to restore the shape of an upper lip. So it's a great procedure for people in both of those categories. I would say for younger patients, you really want to see someone who does a lot of just perioral rejuvenation in general, because there are a lot of things that can make your lip curl in, make your smile not look the way that you want it to. And so sometimes a lip lift is the move. Sometimes we need to try something else first or do something else in conjunction with a lip lift. So if you have a gummy smile Botox, sometimes trying a lip flip with Botox can bridge the gap or just let you try something else out before doing a permanent thing like a lip lift. If you have loss of volume in your lips, then filler. If you have loss of volume in your whole perioral around the face area, sometimes a fat transfer. But then, for people who still have that lip that rolls in, who want that full upper lip where nothing else is really doing it, then a lip lift is absolutely a great procedure. And so for those younger patients, we're really just trying to give you a full, shapely upper lip, but nothing crazy, still in balance with the rest of your lips. I don't want your upper lip to be bigger than your lower lip. That looks crazy. It still needs to be planned appropriately. And then also, planned appropriately so the scar hides, so it doesn't pull down on your nose and change the shape of your nose. It's for a, relatively simple procedure. We really want to do it with a lot of finesse and a lot of attention to detail, because it can go unfavorably. And sometimes people get some crazy scars. Sometimes people get some problems from their lip lifts. And those can be really tough to fix. When I'm going in, it's your 6th or 7th revision lip lift, which, yes, I've done that. It's really, really, really tough because everything's already under tension. There's scar tissue everywhere. It's something that you really want to do right the first time, and then probably leave it alone, or at least leave it alone for a very long time.
For a while.
Yeah, definitely. And then older patients, I think, is where it shines even more as a procedure. Once you get into sort of the facelift age category, the length of your upper lip is one of the biggest signs of aging. Sometimes, you even do a great facelift and fat transfer and all that kind of stuff. But if that distance from your nose to your upper lip is still really long, people still look older. It's not even something that you really lay people don't really notice what makes someone look older, but someone can have a great jawline, have nice full cheeks, not have stuff hanging out under their chin and still look older. And one of the things that often does that is having a long upper lip. It's something that our brain just computes as this is an older face, even completely subconsciously. So yeah, in people who are, facelift age, not everyone, but a lot of people have that long upper lip, and adding a lip lift is a pretty simple, pretty low risk thing to add to a facelift that can really bring results to the next level for a lot of people.
You know what, Dr. Lisiecki, I'm going to take advantage that you're on the show and let's talk about under eyes.
Yeah, definitely.
Oh my gosh. Under eyes is probably like this after BBLs. Under eyes is number 2 of what I am getting a lot of questions about. How do I fix this? Like, why is this starting to happen? Like, sometimes it's just that the under eyes are getting more hollow, but also there's people who have the fat pads. So let's talk about under eyes.
Definitely. You're hitting all of my favorite topics. I love it. And I actually, for those who follow me on Instagram, or if you want to follow me on Instagram and you scroll back a little ways, I have a video where I actually break down all the different things we do for the under eyes, because it's a very complex area anatomically. There are a bunch of things that cause an aged appearance there. So a basic breakdown: if you just have a hollow, if you just have a tear trough in that inner part of your eyes, or if it's really sunken in and there's just loss of volume there, then giving volume back makes sense. And that can be either fillers or fat grafting. I have a pretty strong preference for fat grafting in the under eye area. Fillers, you need to be really careful. Go to someone who is experienced not just in fillers, but also in under eye surgery, because they can cause a lot of complications around the eye. They can just bad things, but just also things that don't look good or don't hold up well with time. To me, that's a go to a plastic surgeon situation.
Area. I think under eyes, or like anything around your eyes, is a be in a plastic surgery office area. Like you need to be able to talk to a surgeon if you're going to a nurse injector or somebody who's not an MD, a plastic surgeon doing your under eye filler, they should at least be attached to the surgeon's office, like with a walkway attached, not within a 50-mile radius, but actually like on the premises.
Yeah. And it's, no one likes to talk about risks of stuff, but there are definitely some risks to injecting, in that area. Have someone who knows what they're doing, someone who has the supplies that they need to manage any sort of complications they get in that area. But beyond sort of immediate things that can be dangerous about injecting in that area, filler in the under eyes can cause this thing called malar lymphedema, which can turn into malar mounds, turn into these things called festoons, where you get really puffy. Sometimes you can get a little, fold with extra skin in that area between your cheek and your under eye. It can cause a lot of problems. And I see a lot of people who, went somewhere, they got filler in the under eyes, and then, they notice a couple months later, it gets really puffy, and they wake up in the morning and it's puffy, or if they drink alcohol or eat salty food, it just swells like crazy. And that's a real problem.
Let's tell them, though, why that happens and why filler works and why, like, how this is all together.
Yeah, definitely. So when you get filler in your under eyes and it's not put in the right place, the problem is, we have lymphatics drain fluid from places in our body, just like you have, lymph nodes in your groin that drain the excess fluid from your legs, or lymph nodes in your armpit that drain excess fluid from your arms. There are lymphatics everywhere in our body, and our lower eyelids are no different. They need to drain excess fluid. And sometimes when filler is inappropriately placed in the lower eyelid, it can gum up those lymphatics, and the filler itself obstructs those pipes from working the way they're supposed to. And so it causes fluid buildup, and people, the hollow in their under eye might be filled up, but they get these weird puffy lumps on their cheeks, and it looks really strange. It doesn't feel particularly good. Sometimes people can get irritated in those areas. And it's the fluid that should be draining out through those pipes, but can't. And it can be really tricky to deal with. You have to dissolve the filler. Sometimes you have to do other stuff to make those go away. So be careful with filler there. So if you're hollow, fillers, or fat grafting, the opposite problem that a lot of people have is they get herniation or bulging of the fat pads in their lower eyelids. And that's really where lower eyelid surgery comes in. So, if you have that tear trough, that groove that goes all the way across your under eye area, and then above it, you have a really puffy, bulgy area, that is usually a situation where surgery is going to be your best fix. That bulging fat is the fat that lives around and pads our eyeballs. But sometimes as we get older, the ligaments that hold it in place get a little loose and it sort of pooches out. And the only way to fix that is to remove the extra fat and tighten things up again. So, that's where I would do a lower blepharoplasty, transconjunctival or scarless lower blepharoplasty, where I make a little incision on the inside of your lower eyelid, take out the excessive amount of that fat, and then do whatever else I need to do to tighten up your lower eyelid. So a canthopexy to tighten the corner of your eye, maybe removing a little skin if you have loose skin on your eyelids, maybe doing things like lasers or Morpheus to smooth the skin in your lower eyelid. Once you get to that point, surgery is really kind of the fix. And then surgery does come with bringing volume back also. Whenever I do lower blepharoplasties, I always transfer fat into the cheeks also, because it just builds up the cheekbone. It helps support the lower eyelid, and it makes a nice smooth transition from your cheek to your lower eyelid. You want to go to someone, when your lower eyelid bugs you want to go to someone who can provide you all the options, because if you just go to someone who the only thing they know how to do is to inject filler, you're going to get filler. If you just go to someone who only does lasers, you're going to get a laser. Fillers and laser can be great. They can do great things in the under eye in the right person, but you want someone who knows and understands all the options and can look at your anatomy and pick what's the right procedure for you, because this isn't, an area we want to mess around in.
What is that saying? Everything looks like a nail when your only tool is a hammer or something like that.
Exactly. Yeah, when all you have is a hammer, the whole world is a nail.
Yeah, exactly. So
exactly.
Kind of go with that.
A clear trough that needs filler.
Exactly.
Yeah.
So what's your opinion on I've seen, and I really love what I've seen in the results of women having PRP or PRF injected into the under eye. What's your opinion on that?
Mm-hmm. Yeah, definitely. I do. I like PRP in the area. PRF is good also. The downside with both of those treatments is just the fill doesn't last particularly long. So,
Well, mm-hmm. I see the best used for under eye darkness.
Yes.
I've seen it do really great results for under eye darkness. So let me make sure I explain myself. For filler under eye, I'm not saying go get some PRF. If your problem is under eye darkness, I've seen really great results with PRP and PRF.
Yes, that. And you were about to read my mind, because that's where I was about to go. But yeah, it's just, if you're just hollow in the under eye, PRP, PRF will give you a little bit of fill in that area. It's probably going to need to be repeated, and it's probably not going to last that long. So if you have the time and, are willing to do it, repeating them is fine. Where it really shines is improving the tissue quality in those areas. And if you have dark circles, PRP can help thicken the skin, can help get rid of that kind of hyperpigmentation you see through the skin of the muscle in that area. And it can make a big impact on darkness. So for me, it's usually not a standalone thing. It's usually something that goes hand in hand with a bunch of other things. So if you're dark in the under eyes, I'll either microneedle in PRP, your whole face, but that area, or inject some PRP in the under eyes to help thicken the skin, get rid of darkness, improve the texture. But then, I'm thinking, what else do we need to do in this area? And that will probably be fat transfer or a lower blepharoplasty with fat transfer. So it's really just like the lower face. We want to think about comprehensive. We want to think about skin tightening and volume and repositioning ligaments. In the lower eyelid, we want to think about thickening skin, improving skin texture, getting rid of pigmentation problems, getting rid of bulging herniated fat, filling in tear troughs, filling the cheek to support cheeks. The best treatments everywhere for everything, at least in the face, is all about balance, and it's about addressing all the things that are the problem.
I couldn't agree more. We covered so many juicy, amazing, good things today. I'm so glad we touched on all of these little things that I had. Man, I need to talk to next time I have a facial plastic surgeon. I'm going to ask about this because my girls ask and I'm like, this is where we are going now with what my girls are looking for. They're younger, looking for how do I not start looking old? What are the tips and tricks that these celebrities are doing to not look old, and how can I do them in my life too?
Yeah, definitely. And it's a tough world. A lot of the celebrities aren't very transparent about it. There are certainly facelifts happen that they don't publicize to the world.
Like,
but it's really, it's an area where so many questions come up. And I would say the biggest thing is find a provider that you like, a plastic surgeon that you like and trust and like the results, and go and see them, because the best thing is evaluation by someone who has, specialization in this area, someone who can look at your individual anatomy and tell you what the best plan is for you and work with you to make a plan that both fits your goals, fits your anatomy, and then also fits what you can handle in terms of downtime, hiding from public. And that's really where a consultation comes in.
For sure. Downtime is always one of those kind of deciding factors of which way they're going to lean. Are they going to go this way or that way? And downtime and cost are the main two factors that I see a lot of my girls talk about. How much time do I need to recover or take off work? And how much money do I need to do all of this? So for our girls who are listening, where can they find you?
Absolutely. So you can find me on my website, drjefflisiecki.com. Instagram or TikTok. My handle is just Dr. Jeff Lisiecki. I'm also on Real Self. Look me up there too. Anywhere that you would look for a plastic surgeon, or better yet, just come to 71st and Park and come make an appointment and I'll see you in person.
Thank you so much, Dr. Lisiecki, for coming on the show today. And this is the last thing before I let you go. If you had to give one piece of advice to our listeners who are on their plastic surgery journey and you're talking to her like she's your mom, your sister, your best friend, what's one piece of advice that you would give her?
So first of all, thank you so much for having me. This was a lot of fun. I really, really love talking to you. My two big pieces of advice, because I don't know that I can pick just one is just make a consultation. You can fall into a wormhole. You can, do all the reading and, looking at before and after pictures and looking at videos on YouTube and reading about procedures and all of that. There's no substitute for someone who knows what they're doing, looking at you, examining you, explaining to you what the best option is for you. Sometimes people come to see me and they say, oh, I read all about buccal fat pad reduction. I need a buccal fat pad removal. And I say, hold your horses here. You need a facelift. And so just having someone see you and examine you is the most powerful thing, and can answer a lot of questions and save you a lot of time and a lot of thought that you don't need to be thinking. We're trained and, we have expertise in this area and can help guide you a lot. And then my second big piece of advice is don't try to get away with the mini procedure or the temporary fix when you really need the full procedure. So, if you really need a facelift, there's no amount of threads in the world that's going to give you a satisfying long-term, solution. And ultimately, you're going to end up getting a facelift, but you're going to get a facelift with a bunch of threads after you spend a bunch of time and money trying to not get the real fix that you need. If you really need a lower blepharoplasty, don't blow up your cheeks with so much filler that you stop looking like yourself, because A, it's not going to it's not going to give you the fix that you want. And B, you're going to waste a bunch of time and money in the process. Better to go in, have someone, who knows what they're doing, evaluate you, come up with a good plan, do it, go for the real solution, go for the long-term fix, rather than just trying to, temporize and hold off and do a bunch of little things, because very often for time, for money, for continuing to look like yourself, the best thing is to just do the real procedure.
Wow, that was such a good piece of advice. I 100% agree. And I don't think we could leave the show on a better note. I think that was perfect. Thank you so much for being on the show, Dr. Lisiecki. And I will see you guys next week. So if you're listening to this episode and you're listening to the Big Butts No Lies podcast, you might be on your surgery journey. And if you are, and you don't know what to do, you don't know where to start, you've come to the right place. I am so excited to do one-on-ones with you guys. I've realized as I do them more and more just how valuable they are to you, not only because you get my expert opinion, I get to guide you towards plastic surgeons that we know are going to do a good job and keep you safe. Besides all that, I get to talk to you about things that might not even be on your radar, things that you don't even know are possible. But since we get so in depth with our conversations and I really get to know what your dreams are and what you're really looking for with your body, I can tailor my recommendations to the surgeons that I know can help you achieve that. And taking the guesswork out of who to go to is invaluable. So schedule your one-on-one phone call with me. You can go to my website, go to the quick links, submit your information, let me get to know you. Let me see how can we help you. You can get your own team. You guys, I have been working so hard behind the scenes to come up with a perfect way for you to have your plastic surgery and not only come out with beautiful incisions, but also feeling beautiful on the inside. So book your call with me and take the guesswork out of your plastic surgery journey.
And don't forget, new episodes every Monday. I'll see you then.